Family systems therapy has done a couple of things that are particularly relevant to the treatment of alienation. First of all, it changes the very narrow traditional focus on internal mechanisms such as a chemical imbalance, intrapsychic conflict, or historical factors as the cause of the identified patient's symptoms. Family therapy rejects this linear model and accepts instead a circular causation. That is, it's the here and now environment, the family interactional patterns that cause and maintain the identified patient's symptoms. And as my mentor, I was one who was trained by Salvador Minuchin. He said children aren't orphans. It's the dysfunctional relationship that is the target for intervention, not the individual. And the treatment intervention is creating corrective family experiences. It's not a focus on insight or validation of feelings. This is a particular pet peeve of mine in traditional reunification therapy, having validation for the child's feelings based on distorted delusional beliefs. This is not therapeutic. This is anti-therapeutic that is often done. So these two main differences separate family systems therapy from every other form of treatment. The site of pathology is in the dysfunctional relationships, both with both parents, the pathological enmeshment with the alienating parent, and words are meaningless. It's creating corrective behavioral interactions. These are just some of the places which Dr. Burnett mentioned this morning, the 1950s. Family therapy grew out of the study of psychotic child patients on the psychiatric ward. And also my mentor at the Wiltwick Residential Treatment Center for Boys in New York. They noticed that the psychotic children would improve on the ward and then regress after visits. So they began to observe the visits, and this is the typical triangulation that Dr. Burnett pointed out that they observed. So mom and dad would get into an argument, and one of the parents, in this case mom, but fathers do it equally, I have to say, that's what the research shows. Mom entices Jane to form a coalition with her to denigrate and dismiss the other parent. This is what they call triangulation. Triangulation is crazy making for the children, and this is what family therapy said was the root of the child's psychosis, not a chemical imbalance. Psychosis or craziness is the result of a catch-22, no-win situation. When the child was co-opted by the triangulating parent, the child could not resolve that seduction, which is what I call it, and have a relationship with both parents, because either the child then rejected the other parent, or in the rare situation when the child could resist the triangulating parent, that parent would reject the child. So the child had no win basis of having two intact relationships with parents. Does this sound familiar? Family therapy's reframe from linear causation to circular causation freed the child from mental health diagnoses such as psychosis, which family therapists said is a misdiagnosis. If a symptom is situationally caused, then it cannot have the label of psychosis. And this is another pet peeve of mine with the way alienated children are treated, because then they are put on psychotropic medications, which are really unnecessary. Those medications cause a chemical imbalance. The child's symptoms are a result of the situation of triangulation. That is not a chemical imbalance and should not be treated as such. when the traditional therapist and their cohort psychiatrists join together to medicate your alienated children, they are making two severe failures in the standard of clinical care. When you have a symptom, it is the obligation of the clinician to generate all plausible hypotheses. It's pure speculation to say, well, the child's saying, I hate that parent, they terrify me. They haven't seen the parent in 4 years, but they're terrified at the mere thought of facing that parent in the context of a therapy session. Well, I have a bridge to sell to you in Brooklyn, if you believe that. I believe it's the loyalty conflict that puts the child in the middle of having to choose one parent over the other that causes these symptoms. What do you want to do? Cut off your right arm or your left arm? That's what this choice does. And the other failure is to consider the total clinical picture. That means the context for the child's symptoms. Isn't it amazing how all your children are healthy and normal and functioning well prior to the onset of the alienation? They only develop these symptoms after the alienation starts. Where is the causal connection? These therapists, in my mind, are committing malpractice. They are not meeting the standard of care when they don't assess the historical development of these symptoms and rush to medicate your children. These are just some of the schools of family systems therapy. Any one of them is competent to treat alienation. I just feel very comfortable with my makeup in structural family therapy as founded by my mentor, Salvador Minuchin. So family therapy says it does take two to tango, even though every family may have a different dance. We do believe that the truth lies in the middle, and we do believe in the 50-50 rule of relationships. However, it's only 50-50 until it isn't. Every clinical situation has an exception to the rule. And therapists who say they practice family therapies do not pay attention that alienation is an exception to the rule. Because it's child abuse, alienation is the exception to the 50-50 rule. When one parent behaves like this and makes the other parent behave like this, it is not a 50-50 relationship. And what I'm talking about here is the research we have on severe alienators, and I believe many moderate alienators as well, that they likely have more than one and up to 3 cluster B personality disorders. Personality disorders are an exception to the 50-50 rule. And this is some of the research. This is actually research by the hybrid people who maintain both parents contribute. They don't follow their own logical conclusions to the end. This is more of some of the contributors who say that. And this is my personal favorite, as discussed this morning by Clower and Rivlin, who followed 1,000 children for more than 30 years and talked about programming and brainwashing parents, and even described some of their behaviors as sociopathic. These are very good references to use in court to establish this is not a case of 50-50. Both parents didn't contribute. Alienators are severely disturbed. So I'm not going to go too much into personality disorders, other than to say they are a great variance with the cultural norms and expectations of their environment. And they are very good at mimicking normal behavior, and that's how they fool you, and that's how they fool a lot of people like me. When I first started learning this, and a lot of other professionals, they are indeed wolves in sheep's clothing, and you have to know this.